Margaret, you've worked with, at this point, thousands of people. They come to see you in groups, they speak to you personally, you do this every day, and the constant theme is people are depressed, they're anxious, they're angry, they're sad, they're lonely. Irving, you've done a tremendous amount of research on this. Could you, instead of just telling your conclusion, explain what the basis is of your conclusion? You know, that's how many people have you seen that have depressed that you've actually seen turn it around? What studies have you seen that, maybe go into a little more detail of why you came to these conclusions as opposed to, tell a little bit of what made you come to this conclusion and how big the data set is that you're basing this on.
Yeah, well, as I said, a lot of people come to me depressed. Very few leave their work. I can't think of anybody that's left their work with me with depression. That doesn't mean that they don't get sad sometimes. We all do, and difficult things happen in our lives. But the real cause of emotional depression, other than physical, is that most people have learned to reject themselves in many, many ways. I started to talk about this before. We reject ourselves by staying up in our head. When we were young and we didn't get the love we needed, there were huge, huge painful feelings, loneliness, heartbreak, helplessness over our parents and others and peers and bullies. And we couldn't manage these feelings, and most of our parents had no idea how to manage their feelings. If you think about your parents, what did they do when they were upset? Did they sit down and think, I wonder what I'm telling myself and how I'm treating myself that's causing me to feel bad? Or did they turn to alcohol or drugs or TV or some other addiction? Did they yell at each other and scream at each other because they were upset? Very few of them knew how to take responsibility for their own feelings, and so their children did not learn how to take responsibility for their feelings. So when they come to me, they have no idea that they are likely causing their own depression because they don't know how to manage their feelings. And so as they learn to move into their heart, as they learn to give up getting out of their head, get into their body, as they learn to tune into these judgments, these harsh judgments that they level at themselves, as they learn to stop turning to various addictions and instead turn inward towards their own feelings and learn from them rather than avoid them, as they learn to stop making everybody around them responsible for their feelings, as they learn to tune into a spiritual source of love and wisdom that they can bring inside and down inside to those feelings, and they're open to learning rather than protecting against all of their pain, because all of our feelings are informational. All of our feelings are informing us about how we're treating ourselves, whether we're abandoning ourselves or loving ourselves, or what's happening in relationship to others. And so if we depress them with medication or with being in our head or judging ourselves or turning to addictions or making others responsible, of course we're going to be depressed. Why wouldn't we? And so when people learn to lovingly learn from and manage all of their feelings, when they learn to embrace their feelings rather than avoid them, instead of getting deeper into depression, they move out of depression, and they move out rapidly. It happens very quickly, sometimes in a day or two, sometimes, like with my client, in a half an hour. When they really get what they're doing, they move out of it. And so for 46 years, I've been doing this, and I've seen this with thousands and thousands of people who were convinced that it was hereditary, it was brain balancing, and it wasn't. It wasn't at all. It was how they were eating and how they were treating themselves.
You had asked Steve about how many patients, how many clinical trials we had looked at and that my conclusions are based on. And what I'll answer that with is not just the clinical trials that my colleagues and I examined back in 2002 and 2008, excuse me, but the most recent data on it have not yet been published even, but it comes straight from the FDA. And this is an analysis by a senior analyst at the FDA of 92 clinical trials with more than 23,000 patients, and the drug placebo difference is exactly the same small drug placebo difference that we reported in 2002. So I'm absolutely certain that these data are reliable. Now I want to mention two additional things. First of all, a warning. If you are currently on an antidepressant, do not just stop taking it. Do not just stop taking it. There are a number of reasons for that, and one of the reasons for that is the problem of withdrawal symptoms, antidepressant withdrawal syndrome. So there can be consequences if you are unhappy taking them, if you're not getting enough benefit, if you're troubled by the side effects and the health risks. Get some help in getting off of them. Don't just stop by yourself. That's the first thing. The second thing, and this also is data-based and looking at hundreds of clinical studies and meta-analyses. Meta-analysis is just a fancy word for putting the data together from a whole bunch of studies and seeing what they tell you when they put them together. One of the things we know is that there are all kinds of alternatives. There are many, many treatment modalities that work at least as well as antidepressant medication. And that includes psychotherapy and various forms of psychotherapy, and it includes physical exercise, and it includes acupuncture, and it includes mindfulness meditation. There are many alternatives that work at least as well and don't have the risks and side effects that are associated with these active drugs. Especially if you've never been on an antidepressant. If you have a loved one that's depressed and has never been on an antidepressant. If it's to be used at all, it would be the last resort after you've tried everything else.
Well, and to just use it temporarily, not for 20 years.
Yeah, I would try to avoid using it temporarily, and I'll tell you why. There are data indicating that using an antidepressant for as short a time as 4 to 8 weeks can increase the risk of relapse and getting depressed again if you do get better, compared to getting better by almost any other means. So avoid them, especially as a first approach, if you don't want to wind up just being addicted to them.
You know, depression, like any other feeling, has information. So instead of avoiding it with medication or avoiding it with addictions, turn towards it, embrace it, welcome it. Ask the depression what it's trying to tell you. That's what we teach. We go inside, okay, I'm feeling depressed. We'll go inside with an intention to learn. In the inner bonding process, there's only two intentions. One is the intention to protect against our pain with some form of controlling behavior, and the other is the intention to learn about loving ourselves and sharing love with others. And so if we move into a true intention to learn about loving ourselves, and we ask inside, we ask that depression, is there something I'm doing, some way I'm treating you, something I'm telling you that's causing you to feel this way? You might be amazed at what your inner self says to you. Try it if you're depressed and see what your inner self says to you.
We are speaking about antidepressants. When I hear other terms like ADHD, attention deficit hyperactivity disorder, and parents are told that they want their kids, the schools say that the kids should be on it, does that have anything to do with this discussion, or is that a totally separate issue?
I think it has everything to do with it because, once again, it's been shown over and over with studies that when children are fed well, then their ADD, ADHD heals, but also it has to do with an environment what happens with the people that I work with is that when they're in a very loving and safe and accepting environment, they also heal. I once had a young man come to an intensive who was suffering from bipolar disorder, and he had had a really hard time. He was on a lot of medication. But within the 5 days of the intensive, all his symptoms went away because he felt so loved and so safe and so secure for the first time in his life. Now, that's not easy to find, unfortunately. So, he had to go back into the world that wasn't so loving and wasn't so accepting. But that's part of it with like ADD, ADHD is helping the parents understand what they're doing, how they're treating the children, and how they're feeding their children.
And I'm going to pass on that again only because I'm going to stick to the data that I have analyzed and that I know inside out. And I've read books that I find very credible that take very similar approaches to ADHD and bipolar disorder and schizophrenia, but I am not going to make any claims about that. I can talk to you about depression and anxiety disorders and the efficacy or lack thereof of antidepressants for those disorders. And so that's what I'm going to stick to.
And is there a difference whether we're talking about short-term depression, a few weeks or months, versus someone who stays on the drug for 6, 8, 10 years? Does it work better for long-term? If you stay on it, is there a difference in your findings, short versus long-term?
Here's what happens. If you get better on an antidepressant and you go off it, you're very likely to relapse. Relapse rates over the long term on antidepressants are about 50% when people get off of them. So they wind up being hooked onto them. Sometimes they relapse and get depressed anyway. Relapse rates with psychotherapy and even with placebo treatment are half that amount. There was this lovely study that was done in which depressed people, were put into 3 different groups. They were randomized. They were assigned to one of 3 different groups. One group was given an SSRI, an antidepressant. Another group was given a physical exercise program. And the third group was given the combination of the 2. Maybe the 2 will work better than either one alone. And there was a nice response to each of the 3 regimens, same size response. And then they looked 10 months later. People got better. How many of them relapsed? And what they found was high relapse rate of those who had been on the SSRIs, even though they could continue to take them. Very low relapse rate. It was about 40% relapse on the SSRI. Relapse on the exercise program was 8%. Very, very low. And what about when you combine the 2? Adding the SSRI to the antidepressant increased the relapse rate back up to the 40%. Adding the antidepressant to the exercise program quadrupled the risk of relapse and becoming depressed again.